Hi everyone, welcome back. So we're going to take two. Sorry, we didn't have video for the first part of it. So we're just going to completely start over. Let everyone have the initial introduction, and then we'll get into more specific questions. So,
yep. Hi everyone. Good evening, Dr. Santana.
Tom Navity.
Hi, I'm Farhat.
Yep. So tonight's episode is about introducing Dr. Farhat to everyone else, our audience. He's the newest member of the Michigan Center for General Medicine. We're glad to have him. So we wanted to just introduce him to you guys, so you know who he is. So quick background, Dr. Farhat.
So I grew up locally. I actually went to Sarline High School, and then I stayed local. Went to Michigan State for undergrad and med school, and then I went to U of M for training. And then I got a position with the neurosurgical group locally. So I've been in the area practicing for 14 years. So I've been a Detroit person, Michigan person my whole life. So I've stayed local, stayed true to the area. So I really understand the area very well. I've lived on the east side pretty much my whole life. So it's nice to be home and help out and be able to treat people that are just like me.
Yeah. So having gone through your medical school residency, what made you decide to go into PM&R and sports medicine?
So I was always interested in musculoskeletal medicine.
Yep.
Growing up, I thought I wanted to be a sports medicine physician, whatever that meant. When I went to med school, I was introduced to sports medicine at Michigan State. So I was interested in this type of medicine. It wasn't until med school that I actually learned about this specialty. I didn't even know it existed. So it was like the perfect meld of musculoskeletal medicine and neurology. So it fit my personality perfectly.
And as part of that skill set, I guess, have you developed a special interest or special niche that you feel really sets you apart from maybe just a general physiatrist or a general pain management doctor?
Yeah, so not only from an interventional standpoint, right, I have the extra skill of being able to do these procedures, but spine has always been my favorite. As a med student, I did an undergrad fellowship as a manual medicine fellow. So I actually practiced for a year, sort of like a chiropractor. So I was always interested in spine. And then while I was in training in my physiatry training at U of M, just starting was the spinal injections. It was really kind of the beginning, right in the early 2000s. So I got introduced early on to interventional spinal injection therapy, and I worked with a neurosurgical group for years locally. So most of what I've done has been spine, probably 90%. But doing spine, you have to be able to determine if it's not spine related, if it's related to a shoulder or a hip or some other peripheral joint structure. So I have treated all musculoskeletal conditions, but spine, I'd say, is probably my favorite and my specialty.
And I certainly would echo that comment. I've shared a fair number of patients with us, or between us. We've had the luxury of practicing in the same geographic region, and now we're in the same practice. But the patients I see that you've treated, the patients who speak of you like your skill set, I think very much echoes what you just said there.
It's really always good to be appreciated.
Yeah.
Is that how you guys got connected? Just being in the community and kind of being, seeing a very similar patient base? And
yeah, so there's a lot of overlapping of patients because our clinic is not that far from each other on the east side. So there would be overlap of patients. And then we were sort of introduced at a conference. We both decided to go to this regenerative medicine conference, and we're on the same plane, right? So it ended up, we finally got to meet and talk to each other, and we were both on the same path of treatment specialties. So at that point, we were both very interested in regenerative medicine. It was really early on introduction to physical medicine rehab. So it was was great. And then Tom sort of started this practice and sort of pulled everybody along with him. So it's been really really cool.
Yeah.
Interesting.
Let's just talk about that a little bit. Your background in regenerative medicine. You're not brand new to regenerative medicine. You've been doing this for as long as John and I have, just in a different location and maybe a slightly different scope. But yeah, talk a little bit about your background and what
How you got into it and all
Exactly. Like, so I think it was maybe 2016 or 2017. There was a conference, one of the PM&R conferences. They were talking about this regenerative medicine, and there was been this discussion over the time frame of prolotherapy and et cetera. So I decided to take the class, and it was unbelievable the amount of information there was, and what was the research that was already being done by all these academic institutions and overseas, and it was eye-opening to say the least. And so at that point, I decided to try to integrate it with the practice I was part of. Which was challenging, I think, because when you offer a certain type of service, people expect the service to be covered, and they sometimes don't realize that it's not a covered benefit as of yet. So it was somewhat challenging to integrate, but I have been doing regenerative medicine for years now. Think about it, probably 6-7 years now, and I've actually seen the evolution, which we were talking about earlier. So I had actually started out with these sort of basic systems that had been just brought on the market by these huge suppliers, and started with sort of the first systems that were available and seeing the progression of the improvement in the technology and what's available. So it's been interesting to see the evolution. And sort of when I saw what you were doing, I said, when this practice was open, I was like, oh my goodness, this is like the perfect scenario. It's got objective evidence, it's a measured system, and there's a lab involved or imaging. It's not just willy-nilly, oh yeah, we do stem cells here. No. This is way different than any other experience anywhere else. So
love to hear that. I mean, that's I guess kind of expand more on that. Do you feel that moving your practice here will help your outcomes, and if so, why and how?
Yeah, so I think the strategy we've always had as physiatrists is to improve someone's function. So most of the strategies we've had so far pretty much just treat someone's pain. It doesn't really solve the problem. So I think the idea of regenerative medicine is to slow down or even stop or reverse the degenerative process. So I think about it now, what we actually do for treatment and what's really approved and thought to be actual data. When you actually look at the numbers, it actually isn't that great of data, but yet this is what's covered by the insurance. It's accepted. So, but when you actually start doing it and you start seeing the results, and you sort of realize at some point you run out of options for patients in the traditional strategy, and so this gives us a whole new world of options. This is treatment for people that don't want an invasive treatment like surgery, where they're laid up for weeks at a time, and recovery and the pain involved. And once a very wise mentor of mine said, you want to try to keep all your anatomy. There's a reason you're put together the way you're put together, right? So if you don't have to disrupt the anatomy, don't. And so I think as physiatrists, we sort of take that notion and we sort of run with it. So that's the idea. And unfortunately, I've seen some bad outcomes from surgical cases, not only spine, but peripheral joints and joint replacements. I mean, it's very far and few between, but it is a possibility that things don't go perfectly. Even the greatest surgeon, even the person with the best technical hands, unfortunately, there are unpredictable variables that can happen. So I feel it gives me an option for patients that may have maximized the conservative treatment or maximized the traditional treatment, or don't even want to go down that route, right? They don't even want to toy with the traditional treatment because they may have had somebody who had a bad experience or didn't work for them. And so I think it opens a whole new avenue for people.
Yeah. I totally agree. Like with surgeries, with regenerative medicine, your treatment options kind of remains pretty wide.
Right.
Big net. with surgeries, your options kind of tend to be really narrow and thin afterwards. So having all these options is also a good thing. There is still room for surgery. I think there's a time and place for surgery, but I think there's also a time and place for regenerative medicine, and introducing that to our patients is kind of what we want to do. With that being said, where do you think this field is going, like in the future, like as far as the algorithm of medicine goes? And
I think the future is bright because, like we talked about it, I just feel like this is the strategy most people would consider. They would rather consider the quote unquote natural options, right, versus a surgical option. And like you said, unfortunately, some people do need operation for certain things, right? So we can't avoid that. But if we can try to avoid that as long as possible and maximize people's function, and I think down the future, who knows? I mean, some of what we have right now is limited by the regulatory process of the government, which is understandable. It's safety first. But I think in the future, if we're able to do more research, I have a feeling it'll be integrated into the normal algorithm of everybody's treatment strategy. PRP might be the first treatment strategy instead of a cortisone shot.
Yeah.
So,
which makes sense. I mean, on the rather than just masking the pain, it makes more sense to try to regenerate or at least stabilize the degenerative process that's leading to the pain, rather than just masking it and letting the pain or letting the process develop and you just don't feel it.
Exactly.
Yeah. And a lot of the studies now showing that steroids are probably not our best option for joints anyway. So.
Yeah, there's a really good study recently that showed that in a confined joint space, cortisone shots may not be the best strategy for people. It sort of leads them down the road of you need that replaced because unfortunately those medications are literally toxic to the joint, and so it's fine. It's ironic that that's what's accepted.
Yeah.
What we're doing seems to be bizarre.
Right.
So it's interesting to see, and you think about even from not only a regenerative standpoint, but even our own body heals on its own, right? So it does that somehow. It has figured out how to do it. So there should be a way we enable that system. And I think that's what we're doing.
That's the road we're on. That's the journey we're trying to figure out,
right.
Incorporating these injection therapies, these other therapies, these peptide therapies, and is it any one of them? Is it all three of them? Is it a combination of everything? And I think the answer lies in it's probably a combination.
They're all right.
Yeah, and it's that secret sauce or that specific combination of ingredients in any one particular patient that is what separates good clinicians from great ones. Those that can follow a recipe, anybody can follow a recipe, but when you can tweak and use your experience and your judgment to tweak an individual's plan, I think that's where you really optimize your outcomes.
Absolutely.
I like your point about how you're right. Like this regenerative medicine used to be an out of the box type thinking, right?
Yeah.
But the more we learn about it and how our bodies heal, we're trying to learn this is actually something that we're already doing. It should be in the box thinking.
Exactly.
I remember one of the conferences we went to, I think it was Lutz, held up, he said he was criticized by one of his surgeons saying, why are you doing such extreme therapies? And he looked at him and he pulled up an x-ray and he said, showing a 4-level fusion. He's like, who's doing extreme therapy? Am I or you?
Yeah.
If it fails, it fails. And you can always go on to surgery. But if you have that 4-level fusion and have chronic pain after, there's limited options after that.
And then that's one thing I was going to say is that let's say it doesn't work, right? Say unfortunately the treatment we have doesn't really work, but let's look at it from the downside. What's the downside? One, it's safe, right? Mm-hmm. There's no foreign substance that you're using. Yeah. It's your own stuff.
Yeah.
It's very unlikely that you're going to get an infection because your body has the ability to have antiseptic properties. Like the stuff we're injecting is actually like an antibiotic, right? It's not going to cause any more damage, right? It's not going to cause any cartilage wearing or like a cortisone would, or even the lidocaine, the anesthetic causes this stuff. So it's sort of intuitive to think about, like, why aren't we using this more? Why isn't it the first treatment? So not, and it makes you just wonder why, you know. And so I just think it's just we don't have enough information. It's not exposed enough. But if people really understood what was happening, I think they would be more willing to consider it as an option.
It's fun to see more physicians start to reach out to us, ask us questions,
Yeah.
looking for training, incorporating these therapies, whether they're orthopedic surgeons or they're pain physicians like ourselves, incorporating these therapies into their treatment plans for their patients. It's really rewarding to see the community starting to embrace this. And now, hopefully, we can help even more physicians offer these therapies at a very high level for their patients.
You know, it's interesting that you say that. You know, these when the surgeons are after they do their, let's say, put their hardware in or whatever, they're actually a lot of times drilling into the bone to release the bone marrow in that area to help heal that area. They're taking blood and they're mixing in with PRP now. Some of the treatments for the surgeons, they're using it as a vessel to sort of help heal the area as an adjunct of what they've done mechanically. So it's being used. It's just a matter of making it more available, I think.
Yeah, very well said.
So I guess kind of a more difficult question. Why don't you think more doctors do this? I mean, you were incorporating this slowly into your practice. It took, Dr. Santana and myself some time to incorporate this into our practice. Why aren't more doctors jumping on this?
Oh, so I think the biggest concern, honestly, would be the cost. I think because people are the thought process is I've already paid for it by insurance, right? And they should be covering something. And I don't have to pay extra for a treatment that theoretically should be covered, regardless if it's correct or not correct or whatever the case may be. But let's think about it from a cost perspective, right? So let's think about if you had to have an operation, right? So let's say a lumbar surgery. So minimum, even if you have the basic surgery, usually you have restrictions for about 6 weeks, right? So if you have a job that requires you to do some type of heavy lifting or work, you can't work, right? So you lose your finances from the 6 weeks you're not working. You probably had to pay a deductible or a copay as part of the recovery process of your surgery. And then there's physical therapy and so on. So the cost builds up very quickly. And this is theoretically supposed to fix you, right? And so I think if you look at it that way, and people should think about it is if they're going to spend money, they should spend money on themselves versus like some other issue or some trip or who knows exactly. But I think that's the biggest hurdle. I think it's the cost. Not necessarily that people look at this treatment as completely out of the box, as you said, but just that the fact that they could do it if they could pay for it.
Yeah, no, it's definitely been our experience and a lot of, I know my colleagues' experiences. It's a difficult change of mindset when you're getting outside of third-party payer insurance. What is allowed, what's recommended, what are the guidelines, and we're working on that. With, collecting data and doing outcome registries, and our patients are a big part of that. So those of you who are filling out our surveys, thank you very much. That helps prove that what we're doing is making a difference in people's lives. And from a cost standpoint, from just as you outlined, from a benefit and not just in that it's cheaper than surgery, it actually has less downtime, so people's work and their incomes are less impacted.
Yeah. And then recovery time is a lot faster too. And it's I think it's a big thing for everyone too. And then the other thing to mention, not just, by not doing anything, just kind of dealing with the pain, you're missing out on a lot of opportunities because of that. So there's also the cost of opportunity lost as well, right? So there's definitely decisions need to be made, and having that data registry showing proof of the work definitely helps with that calculation.
And I wish I could tell you every time we treat somebody, they get 100% better.
Mm-hmm.
It's not really what we're saying. It's that we're trying to choose this treatment that's appropriate for patients, right? And so it gives us another option versus sort of the accepted treatment strategy.
Yeah.
So it's not like everybody that walks in the door is a candidate for regenerative medicine.
Correct.
So it really comes down to making sure whoever comes in, whatever their problem is appropriate for this type of treatment.
And like I said, being experienced in doing a lot of procedures for spine, joints, having a big toolbox to work with, it gives patients a lot of options.
Absolutely.
All right.
Yeah, so I mean, in summary, I don't know if you want to kind of summarize your introduction, but I mean, we're super excited to have you involved. We've known you for a long time. You got amazing background, amazing training. I've enjoyed working alongside you in the community now. Really looking forward to having you in the practice. I know I'm going to learn a bunch. Just a couple of times I've been in the OR with you. I've learned some different techniques and some different strategies to target some stuff targets that are tough for me to get into. So really excited to learn from you and have patients get better from your therapies.
Yeah, honestly, I'm excited too. It's whenever I leave clinic here, it's like the best I feel all week. And it's the fact that the people that work here, Tom and John, and the staff and the patients, it's a different attitude when you walk in versus the traditional or a regular clinic where unfortunately we're dealing with certain issues and bureaucracy and a lot of stuff that really has no influence on how people improve. So feels great to actually practice medicine the way it's supposed to be done. So
it's awesome to hear. That is our goal. That was our mission, was to build a practice that really focuses on getting people better and not one that just follows the guidelines or follows the rules, right, or lets the insurance companies tell us what to do next, and we just get in line and what they want us to do, but actually talk to our patients, listen to our patients,
do the best,
hear our patients, and give them what we think are the best options for them.
Yeah. Great. Love to have you on board.
Yeah,
exactly.
Exactly. Super. Very excited. So thanks everyone. I think we kind of went a little over. We'll get back to your questions. I appreciate you all that tuned in tonight and the questions that you asked. We'll respond in email form if we can. All right. Thank you.
Good night.
Bye.
Good night.